back as promised to continue this little video series of this horrible period of my life that I know many other people are probably looking for videos on, because that's what I was doing. So this video is going to be about my TFMR, termination for medical reasons, at 22 weeks, and my experience with it, because when I found out I needed to get it, I was searching everywhere for videos, and I found some, but like nothing that went into the procedural aspects of it, which is what I kind of really wanted, because I'm one of those people who, like, when I have to go into something like this, I just want to know everything. Like, if I'm going to have pain, okay, but I want to know I'm going to have pain. If it's going to be awful, okay, but I want to know. I don't want to be surprised, but that's just my personality. So if you're like me, you probably feel the same way. So the one group, let me see if I can find it, that I was on, which helped me a lot, was on Reddit. Reddit was like my lifesaver through all of this. So if you have a Reddit, definitely go to the TFMR _ support group, because they have a lot of great, fantastic supporting women who, like, if you're having anxiety, you just write a post and you get all these answers, and you could search for like certain questions you might have and find them. So I definitely recommend finding something like that. For me, though, that wasn't enough. I wanted more. Like, I wanted to hear someone's story of it, not because it would deter me. I mean, you have to get it done, but just because for me, the more you know and the more prepared I am, the easier it is. So I hope that this video helps you. I hope you're the same type of person. So to explain a little bit of my story, I don't know if I'm going to go into the whole pregnancy thing right now. I think I'll wait for like a whole story time for that. But basically, we found out late that our baby had triple AD, and no baby survives triple AD at all. It's 69 chromosomes. The baby will either die in utero or will die as soon as it's born. So most of the time, though, they're miscarried like super early. So it was very weird that it didn't miscarry so early. By the time we went to the D&E appointment, the amniotic fluid was like almost gone. The head was just getting worse and worse. So it's like the baby was on its last, little hours, and it was very sad. But if you have to get this done, I'm assuming you already have your OB or your maternal fetal medicine doctor would recommend you to a certain place, OB or clinic. Even if someone recommends you somewhere, do not trust blindly. Please, I beg of you, Google it, look at the Google reviews, look and see what you're dealing with. I loved my genetic counselor, but the person she recommended me to was awful. I don't even think she realized how awful this person was. Horrible reviews, like botched. And if you want to have kids again, especially if you were trying for a while and then this happens and then you have to go through it, you don't want to be with someone who has botched ratings. So I actually Googled and found one place that was like, it's all they do. But because of that, there's also protesters there, which was awful. I'll get into that. But you want to go to a place that has really good reviews. It's all they do, because when you're having a second trimester termination, it's more risky, because they have to dilate you, they have to get the baby out. And if you were like me, I'm 36, I never had any kids, so my cervix was very, very small. The dilation can be a little trickier. You want to make sure that you go to a clinic that knows what they're doing, because they'll do it slow. You don't want anybody just pushing open your cervix. That's how you can have complications with your cervix and future pregnancies. You want people who really know what they're doing. I don't want to scare people with this, so if you're one of those people who don't want to know about stuff until you experience, I'm just going to tell you, click away. Because, I don't want to jar anybody, but the reason why I'm doing this is because I think it's better to know, because it's going to be that way either way. Statistically, the D&E is a lot safer than getting labor and delivery, because with labor and delivery, you're going to be laboring for hours and hours, and they might still have a retained product anyway, and they might still have to do a D&C. The D&E is quicker, but that's something you should consider. Maybe if you want that, that's fine. Everybody's different. With me, I wanted to just get the procedure done. So when you go into the clinic, at least with my clinic, but I think it's pretty standard for most places, they take your blood, you give a pee sample, you get your initial ultrasound, which looks at the baby, and That's when the doctor told me, like, the amniotic fluid is almost gone now, the baby's on his way out. And then you talk to normally a counselor just to make sure that you're okay with everything. And then you go back into the room, and then was dilation time. And when he looked at me, it was like, your cervix is really small because you've never given birth before. So he knew he couldn't push dilation sticks. And he told me for some people he puts 12 in right away. So if you've had like 3 kids, he'll probably put 12 in right away, and it probably won't be nearly as uncomfortable for you because your cervix has already been dilated already. But if you're basically like a virgin birther and your cervix has never been open, if you go to a bad clinic, and they could end up hurting your cervix if they put too many in. So I guess he said he only put 3 in. I thought he put 4 in, but the first day he put 3 in. And I will tell you, yes, it hurts. It does hurt. But the thing is that it's done very quick. Okay, so I equate the pain right now to like when you stub your toe. That really, like, that pain when you stub your toe is like awful, and it's quick. So like the whole process of putting the Lemare sticks in was quick. I think it was done in less than a minute. If you don't tense up and you don't like lift your butt or like stop breathing, it's easier. Because with me, I kept like out of anticipation and fear and out of pain. I was like not breathing and like lifting, like I would jolt back, and it made it a little difficult for the poor guy to get the sticks in. But it's over really quick. It's almost like if you're afraid of getting your blood drawn, it's almost like as quick as getting your blood drawn, maybe a little bit longer. Maybe you get blood drawn twice in a row. But where the pain really comes into is afterwards. And I think it's not like a period cramps. Like some people are like, oh, it's like period cramps. No, I would say it's probably like a laboring because the pain is like more intense. But the good news is, which I did not know, is it does stop and it eases up. So like after you get the Lemare sticks in, it's so quick. It's painful, but it's quick. And then you're like relieved. You just feel a little uncomfortable, like the cramps you get when you get your period, where you feel your period coming, and then like I thought I was gonna poop because like when I get my period, like I feel like you feel the muscles contracting there, so I'm like, oh no, I have to go to the bathroom. To the point where I even asked her if I go to the bathroom like number 2, are they gonna come out? Like I was so paranoid about everything. But it's basically like you get the Lemare sticks in, it's done super quick. Yes, it's super painful, but it's over as soon as you know it, and then the pain starts coming on and like climbing. Like by the time I was out of the clinic and in my car was when it was like really starting. So after I got the Lemare sticks in, they gave me 2 antibiotics to take home, to take that day, one with lunch, one with dinner. They gave me the part 1 of the abortion pill, which is supposed to soften your cervix, which I do think made the Lemare sticks the next day easier. You might not have to get dilated twice. I had to get dilated twice because my cervix was so small and they wanted to try to do it safely. So when I was in the car, that was when the pain was very unbearable and I couldn't take it. It was so unbearable because I couldn't get comfortable. When you're in a car and you're sitting up like this, and even if I go back, I need like softness. I can't explain it. And my problem was that we got a hotel, which I highly recommend. My problem was that the hotel wouldn't let us check in. Like my husband was on the phone with them saying like, my wife is in a lot, we need to check in. She's got a procedure done. And the girl was like, not till 3 o'clock, you can't check in. So it made my anxiety worse because when you're in that much pain, I think it was 12 o'clock and I thought I couldn't check in anywhere till 3 o'clock. I was having like a panic attack. So I just wanted to I kept saying to my husband, I need a bed. I need a bed. I need a bed. Luckily, my husband drove there. He like got his food and got my pain. They gave me like Tylenol codeine. Got my pain meds. We went to the hotel. He went in, and then he kind of demanded that I get a bed. And then I got a bed. And as soon as I laid down, I started feeling better. It was like the comfort of a bed. I can't describe it. So if you are getting this done, I don't care if you're like 30 minutes away. If you can get like a Super 8 motel or something that you can check into before you have the procedure, ideally, it's a lot better because if you could have a place to just go in the bed right away, get comfortable. The good news is that the pain does go away in like an hour and a half. So my appointment was at 9:30. I think I got the Lemare sticks in at 11, like 30-ish. I drove to a little food place to get my pharmacy and my pills and stuff. It was like 12 o'clock then. So about, I would say, when we got, like an hour and a half, like literally by 2:30, I was good. Like I was laying on the bed, we were watching movies, I was able to eat, I was happy. So it doesn't last long. If I would have known that the pain would subside in an hour and a half, I think I would have mentally felt better, but I was in a full panic mode because I was like, what if this pain lasts all night and I have to deal with this from now until tomorrow, like I was full on panic. So just know the pain doesn't go away. What I recommend is having a hotel that you already are checked into, so you can go right to, or if you live by the clinic, like no more than 30 minutes. If you live more than 30 minutes away from where you're going, get a hotel. Just trust me. Get a hotel. I mean, if you, especially if you get dilated, I just recommend it, because you just, if it's like there's a hotel right down the street, get a hotel so you can just go lay down and go to bed. So I was fine for the rest of the night. I was happy, but I had anxiety about the next day because I knew that I had to get dilated again because my cervix was too small. And I did. I got dilated very early, and again, it was painful. It is painful. And because this time I knew what was coming, I knew that the pain was really going to set in and the cramps were going to set in after I got him in. I decided to tell my husband to leave because I knew he would get very stressed if he saw me in distress. And, you know, OBYN, like those types of beds with the stirrup things, are not comfortable. So they offered to let us go in a room by ourselves so we could spend time together before surgery. But I just said, no, you leave, to my husband. And I told him I was going to go down by myself, which thank God, because I just didn't want, I probably, if I would have stayed up, I probably would have ended up puking, because they give you the abortion pill then, like the second part of it, that dissolves in your mouth and it makes you very nauseous. So the fact that I went downstairs right afterwards, and got processed and stuff and brought over. I got the IV put in right away, with the, or actually my hand, with the, what's it called, Zofran, or, you know, the anti-nausea drug. It was good, because otherwise I think I would have been puking. But back to going downstairs, my husband then, you know, the way the clinic was upstairs was the first part, and then you walk down the stairs and go into another level for like the operating area. So we went down the stairs, and when my husband opened the door, there's all these protesters outside, like, screaming how evil all of us women are. And I was hearing girls coming in crying because these protesters were, like, right by the door. And luckily, we got there early, so I was trying to avoid the protesters. So we got there, I saw them walking, and we ran in the morning. But I felt so bad because I'm sitting right there in the bottom section of the clinic, and I can hear the protesters every time the door would open, and the girls crying, and they're like, oh my God, it's traumatic. Protesters are just obnoxious. I can't take them. Basically, they took my phone when I was in that lower level. So I was like, great, I'm going to be sitting down here from 8:30 a.m. until afternoon dilating, and I can't text anyone. I don't have my phone to entertain me, which is stupid now that you think about it, because I was in so much pain anyway from the dilation the first hour and a half that I wouldn't have even wanted to be on my phone. So they put me in the gown when I got down there, gave them my phone, went in, they got me comfortable. I knew to ask right away for the Zofran. They put it in my IV, and then I just laid there, got comfortable, and I think I was like in and out twilight state. I don't know if the Zofran made me sleepy, but it felt like it did. And then they came in, they woke me up, and they said, all right, time for surgery. They took me over there, and it felt like after that it was all over. So my recommendation for day number 2 is when you go in for day number 2, if you get dilated or not, because not everyone gets dilated a second time. I did because my cervix was so small. But when you go in for day 2, they'll give you that second pill, the ones that dissolve in your mouth, and then they'll probably have you go lay in the OR bed waiting for surgery. Request nausea medication right away. Even if you don't feel nauseous yet, request it. Because from me reading and looking this stuff up, I realized I should do that. And so as soon as she put me in the bed, I said, can I have the Zofran? And she started putting my IV in. So she put it in right away, and then it was like as soon as she started putting it in, that's when I started felt the nausea coming, so it was the perfect time. And I got verified that was a good choice, because when I woke up from anesthesia, there was a girl across from me puking because she just had the abortion pills and she didn't have any anti-nausea, and I woke up to the sound of her hurling because she was nauseous. So I do recommend that. Make sure you get the nausea meds. So if I can make any recommendations, just a summary, it's if you have a far drive, more than 30 minutes, and if there's a hotel nearby, definitely have a hotel that you're already checked into that you can just go lay in the bed after dilation in day 1 and just relax. Like mini vacation feeling vibe. You need that. Have a heating pad with you for the cramps. That would have helped me tremendously on day 1. I wouldn't have been as miserable if I had a heating pad. Day 2, after you have those pills that dissolve the abortion pills, make sure you ask for anti-nausea medication right away. It'll make your experience so much better. And then just relax, get comfy, and then after that, it's done. Like, no more pain, it's all done. And also ask for footprints if you want them. You can talk to them about, cremation, anything like that. But just try to focus on making sure that you're going to be comfortable and have those things, because I know if I would have had a place I was already checked into, if I would have had a heating pad, if I would have, just had the comfort things lined up, it would have been a better experience. It was really hard only because of that period of time being in my car, or my husband's car, just like waiting for comfort of a bed. But it really goes by quick. I felt relief afterwards only because I already did the grieving process of it. I just felt relief. And now I'm just trying to focus on getting my cycle back. So I'm starting to take vitamin A, hoping it will bring my cycle back. I'll let you know how that goes. And I know that the period can be wonky. So in about 2 weeks, I'm just going to start testing my ovulation, just because I want to see like if I can track an ovulation, because I know when I ovulate, I'll get my period 2 weeks later. So I'm just trying to figure out, doing things that help me investigate and see what's going on with my body, help me kind of. It's weird. It's hard to explain. But I just like to take control. And like I said, I'm really sorry if you're going through this. It's horrible. Words can't express how hard it is. I hate the people who act like this is so wrong and so bad to do. Because I would say almost everyone who has to get a second trimester termination does not want a second trimester termination. And the reason why it's a second trimester termination is because you end up not finding out the serious things until late, And I'll just say with ours, we thought everything was fine. And we had an early anatomy scan. And with the early anatomy scan, that's when they found like fluid in the brain and these weird markers, like a 2-vessel cord. So we were traumatized. We did amnio right away. Not bad. It was not painful. And then during the wait, that's when me and my husband started talking. We were like, well, as long as it has, as long as it can live, and if it could be fixed by surgery, we'll do anything. And, I was looking up the, what is it called? Forget the word now. I'll have to ask my husband. There was fluid in the brain. It's an H word in my brain. I can't remember right now. But we were looking up the surgery, like the stent surgeries for that, and we really were not thinking there was anything wrong with the chromosomes. And then when I found out that it was triploidy and there's no chance of survival, it was just because I was in living mode. I was in like, this baby's gonna live. How can we help it live? I knew he had one kidney. I was like, that's fine. I don't care if he has one kidney. I knew he might need brain surgery. I'm like, that's fine. He might need brain surgery. And then boom, not compatible with life. Like there's not one living person with triploidy on the planet. So then you have to go from baby excitement and planning the nursery and planning your baby shower and making a registry to like literally dismantling everything that you were consumed with emotionally and excited for in 6 months. And when people have like the audacity to be like, how you're evil for killing your baby, how dare you? It drives me nuts, because it's not like this is a situation any of us want to be in. I was also there with a woman who miscarried late and found out late, I know heartbeat, and she had to, do a D&E, and she was devastated. And that was like a healthy baby that just stopped its heart stopped beating, So I'll post a picture of the feet. He had 2 right feet. So cute little feet though. I'm going to keep them. We have a little box for him. And like I said, we're going to go IVF route. That will be the next thing I start documenting. And hopefully this helps someone. I'm going to record another video real quick on NIPT. And some advice for that, which I wrote a lot of notes on, because I could have prevented all this if I would have done the right things with my NIPT test. So I hope this was helpful to someone. I hope that you keep in mind to research your clinic. Make sure you have comfort set up. Make sure you have a place to go lay down. Make sure you have like a heating pad. Stay calm. It goes by so fast. I literally, if I could get through it, you can get through it. Stay positive. If you have any questions, just put them in the comments. I'm sure I'll see it. And I wish you the best. I'm so sorry that you're dealing with this right now and have to watch this video. I wish you didn't. But till next time, you guys have a good one, and I'll talk to you later.